Well, hi everyone. Good morning, and thanks for joining us. I'm Susan Demas, the executive editor here at Lincoln Square. And joining me today again is Dr. Rob Davidson. He is a Michigan ER physician, and he is also the executive director of the Committee to Protect Healthcare. He has launched a Substack, Paging America, where he keeps everybody up to date on the many developments going on in healthcare policy right now. And we will be talking about what's going on right now with the Senate hearing on RFK Jr., the Health and Human Services Secretary. So it's a great time for this conversation. Thanks again for joining us, Doctor.
Yeah, good to be here, Susan. Thank you.
Yeah, well, I know we've both been keeping an eye on the Senate Finance Committee hearing featuring RFK Jr., who's been brought in to find out what exactly is going on at the Centers for Disease Control and Prevention. As we know, there was a lot of drama last week where the newly appointed CDC director, Susan Monarez, was fired for not going along with RFK Jr.'s anti-vax agenda. And that led to a wave of resignations and a lot of concern about policy because, as we all recall, during the somewhat tense confirmation hearings for RFK Jr., there were a lot of questions about his um, background as a vocal opponent of vaccines, not just the COVID vaccine, but all vaccines. And, he made the promise that if you want a COVID vaccine, you can get one. And that promise has been broken. And we're getting into that. We're really heading into flu and COVID vaccine season right now. So, um, Dr. Davidson, can you just tell us what's your take on what we're facing right now and what kind of questions you think RFK Jr. should have to answer?
Yeah, I think the concern is just what you said. We are heading into that season with flu, COVID, other respiratory illnesses, and people getting COVID makes them susceptible to other respiratory illnesses. People, with COVID have a higher risk of getting pneumonia, a higher risk of getting blood clots. Unrelated to specific infection, but it's really frustrating and a bit scary as an emergency doc who has seen the worst times during COVID. Where we had people coming in with oxygen, 50% or so have been sitting at home sick. Numerous people coming in who didn't want to come in because they found, read on Facebook that we were going to kill them by putting them on ventilators or by giving them certain drugs.
Yeah.
And then we got a guy who is at the center of all of that, running HHS. And so as he's sitting in the Senate Finance Committee hearings today, I heard right as we were starting here, I was just kind of logging off of the C-SPAN coverage of this, and Senator Cassidy, fellow physician from Louisiana, Republican, was starting to question him, and he posed a really interesting question. He did it an interesting way. I forget. He said, "Do you think President Trump deserved a Nobel Peace Prize for Operation Warp Speed?" Right. So
Mhm.
Operation Warp Speed, brought the COVID vaccine really to the world, but certainly to the U.S. in an amazing amount of time, saved millions of lives by rapidly developing and deploying that vaccine. And then when Biden came in 2021, really getting those shots into arms. I mean,
Yes,
this was an amazing effort, and any
it
normal,
was.
rational president or administration or human would have been talking about that every day, running on that. They would have had hats that said Operation Warp Speed and signs and bumper stickers, and that would have been the reelection campaign. And unfortunately, the politicization of all aspects of COVID prevented that from being a possibility. And Kennedy said, yes, I think he should have gotten that. But then Kennedy, in previous answers, said that the vaccine killed more people than the virus. And
Which
so
is a
Cassidy was
complete lie and is
total
just so
BS. Yeah.
damaging. Yeah.
Oh, it is. And so now we go from this guy, right, fomenting all of the distrust in science, distrust in the CDC. Now at the head of HHS, which oversees the CDC. Now he gets to bring all of that to actual policy, and the FDA now limiting the people who can get COVID vaccines to people over 65 or people with pre-existing conditions. Right, they're bringing this all to fruition. It isn't just uh, you know, people seeing crazy shit on Facebook or on Twitter. people hearing it directly from the government, a previously trusted source. But then you have them saying, and I heard this come up in the hearings, well, there's distrust in the CDC, distrust in the FDA. The problem is the people running it now were the ones who fomented that distrust,
Right.
peddling absolute nonsense, right?
Right. I mean,
Absolute
that's kind of
misinformation.
a hallmark of conspiracy theories.
Yeah.
It's I'm just asking questions and
Oh,
then I sow doubt and then we need to get rid of, these highly effective vaccines. I mean, it's
yeah,
just this cycle of disingenuous argument that
right.
results in lives being lost.
Yeah, and honestly, like sitting here before you, I've been doing medicine for 25 plus years. If the vaccines killed more people than the virus, there's no way on earth I would be talking about their benefits. There's no way on earth I would take them or have my children or my family get them just on an anecdotal basis, you know? Like
Right.
that's absolute craziness that those of us who are charged with taking care of patients and keeping communities healthy and safe to a person, I mean, beyond some of the crazy right-wing folks in medicine who have kind of jumped onto this MAGA bandwagon, the
Right.
vast majority of physicians and nurses and folks involved in healthcare absolutely see the benefits of the vaccine, the dangers of getting infected, and have taken it, have recommended it, and continue to speak out about the benefits. That
Right.
doesn't happen by accident, and we don't do that. I've Pharma's never given me a penny in my life. I think I got some pad thai and residency during conference from a Pfizer rep because they were, doing the conference that was back in the late '90s, and I'll own up to that. That's the last time Pharma gave me anything, $8 pad thai, so that's okay.
Well, you take an oath, the Hippocratic oath, where you are sworn to save people's lives.
Yeah,
That is not an oath that RFK Jr. has to take, and if he did, he would be breaking it because the fact that we were able to get a COVID vaccine, in such a short amount of time is a miracle, and that was based on the work of years of research for
yeah,
mRNA vaccines that were done painstakingly, researched by our best scientists here and around the world.
right,
And, I know that back in 2020, you and I had many discussions criticizing President Trump at the time for his COVID response. And there was much to criticize.
right,
He did not embrace wearing masks. He was going after states like in Michigan, where we did have, health restrictions so that we could stop the spread of the virus, and he made it a political issue. But at the same time, the one thing he did absolutely right was allowing Operation Warp Speed to continue, letting, our best scientists go to work on this so that we could get a vaccine out to the most amount of people in the quickest amount of time and make sure that it was safe and effective. And he did that. And now, it seems that in appointing RFK Jr. to this absolutely critical office that has undone so much of his legacy. And now, you're seeing these tweets from Trump where he, is sowing this distrust, going along with RFK Jr. and his conspiracy theories, undoing his legacy. And, the only thing that I can see, because, it's not that this is a popular platform, people might have doubts about vaccines, but by and large, they're still popular. People still want the right to choose, the right, to get the vaccines if you
mhm.
want, which RFK Jr. is taking away our choice. But, it's not a secret, looking at where Trump is politically. He is down in the polls on the economy, on immigration, on crime. He's looking for a way out, and his base is kind of separated from him about the Epstein files. And so to
Mhm.
me, this is about him trying to gain back, that MAGA cred by going after vaccines and siding with RFK Jr. And, this now jumps from being a political issue to people are going to get sick and die. I mean, that's very serious.
Yeah, I think you're right. I think embracing RFK Jr. I mean, you remember back during the campaign, RFK Jr. It was reported that he was sort of peddling his endorsement to both sides, right?
Right.
Like
Right.
he was a guy, looking for someone to give him what he wanted so that he could bring his MAHA coalition to be as a political, a political bloc, a voting bloc. And Trump, ever the transactional individual, I mean, obviously embraced it, right? Right. Kamala Harris, I think if RFK Jr. had come in espousing the ideas of his father or his uncle, or the rest of the Kennedy clan, would have embraced that. I'm sure. I mean, that entire family has disavowed themselves from everything this guy has stood for
Right.
now. And so Trump, being transactional, took him on, promised him HHS and whatever the hell he wanted to do there. I mean, if you want to give some buddy of yours from the golf course, the ambassadorship to some country. I mean, I wouldn't encourage that, but I'm sure that happens, right? To some less strategic countries out there, or some political position somewhere in the administration that deals with who knows what protocol, or kind of that kind of thing. But to do that with this position, right, running, I would say, is it the second biggest agency, cabinet position to defense, maybe, as far as spending? It might be ahead of spending. I don't know. It's 1, 2, right up in there. But
Right.
that also then has such an impact on the health and well-being of people in this country,
Right.
right? That was reckless. No one would have expected anything different. And I think you're right. He is clinging to this voting block, this block of support of MAHA. But if you're referring to a post he put out about this, he really twisted himself in pretzels. Like, on the one hand, he said some people are saying that was the greatest achievement ever, Operation Warp Speed, but then the CDC is being ripped apart, and Bobby's needs to be given this, chance to make things right. And I think he spoke out of three different sides of his mouth
Right.
in the
Right.
one post. So I think he and his inner circle have no idea what to do with RFK Jr., because they must look at it and recognize, like, this guy's is bad news. This guy's actually going to kill people. But we can't say that, right? We can't say
Right.
that out loud, because we're going to piss off a whole lot of people that we need to cling together this very minimal amount of support that they have.
Right. I wanted to talk to you about this MAHA movement, make America healthy again. It's clearly Orwellian, but it seems like it definitely has its roots in this wellness movement, and obviously on the surface, there's nothing wrong with trying to embrace a healthier lifestyle and do what you can to improve your health, but it seems like this is kind of a gateway for a lot of people, into some of these anti-vax conspiracies and this idea of like, well, if you're just healthy enough, you'll never get sick, you'll never get cancer, which of course is not true. There are so many environmental and genetic factors. You can do absolutely everything right and end up, with a debilitating disease. It's not about, the fact that if you're just good enough, you'll be okay. And so it's kind of a real toxic concept. And it seems to me that RFK Jr. has, been able to be very successful with, marketing this idea and getting folks obviously from the right, from the MAGA right, but some people, on the left side of the spectrum too, especially in this moment after the pandemic when it just reshuffled all of our lives and people are looking for answers.
Yeah, I mean, I think certain aspects of the MAHA kind of agenda make complete sense. Should we be getting pesticides out of our agriculture to the extent possible? For sure.
Right.
I don't know the exact data and science behind that, but I would appreciate having less pesticides in the things I eat. Should the dyes in our food be, better regulated to not include cancerous or carcinogenic dyes? Absolutely. I do think some of the science quote that they've touted is a bit trumped up, but nonetheless, like, would I be sad if red dye number 40 was gone and beet juice was used? I question, though, whether there's somewhere in there a profit motive and a grift for RFK Jr.
Mhm.
and some of those folks.
Right.
Because if you look at, we haven't heard much from Trump's appointee to be Surgeon General, Casey Means, right? That's the
Right.
doctor who dropped out of residency, and she started an entire platform where she sells wearables, right? She sells glucose monitors,
Mm.
and has made millions of dollars off of convincing healthy people without diabetes that monitoring their blood sugar is the key to their health.
Right.
whereby that's never been shown to have any impact on people's health if they don't have diabetes, right? Eat a well-balanced diet, get enough exercise. Like a lot of aspects of what they're saying are things people can do in their regular lives. And frankly, a lot of the policies that Republicans who have kind of took on this MAHA group, they've rejected policies that would improve people's ability to lead healthy lives, like more public transportation in places so people don't have to drive as much. Having communities that have green spaces where people can get out and walk and get exercise. Those absolutely have been embraced for years by primarily Democratic politicians, and
Right.
as a motive of profit and kind of auto companies and others, big oil companies, still pushing this agenda where people should be driving everywhere, have really kind of set back that whole movement. You go to other countries and cities are built around, public square, and you walk down to get your groceries, you walk to get your, various items you need for the day, and people walk, 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 and particularly in our cities that Trump is also attacking now with trying to occupy them.
Right.
We see this. So yeah, it's tough because again, aspects of MAHA, you say, well, that makes complete sense, of course.
Mhm.
But it seems like you have to swallow the whole big red pill if you're going to be considered truly MAHA. So you have to accept the crazy shit about vaccines causing illness, right? Making people less healthy, which vaccines are the greatest single achievement in the 20th century for improving people's lives and improving people's health. The other
Right.
piece of MAHA, they have nothing to say about gun violence, right? Gun violence is the leading cause of death in pediatrics in this
Yeah.
country. They got nothing to say about it. It's crickets when you have a mass shooting. They have very little to say to nothing, and also support a party that takes away health insurance from poor people and working people when they cut Medicaid for tax cuts for billionaires.
Right.
And so if we're going to embrace people being healthy and staying healthy, we should want people to have health insurance and have access to a primary care doctor so that they can, you know, keep themselves healthy and their families and communities healthy. Somehow that doesn't make it onto the MAHA agenda, right? We do vaccines, we do
Yeah.
pesticides, we do dye, we do wearables, but having health insurance, right? Promoting gun violence prevention, better green space, walking space, that doesn't make it onto the agenda, which seem to be pretty important pieces of making America healthy.
Yeah, it's a very individualistic, viewpoint on things, as opposed to, you know, the bigger issues, which is, now we're facing tens of millions of people who are being kicked off of their health insurance, and millions more are probably not even going to be able to afford it. If
Yeah.
you look at what the premium hikes are
Mm.
looking at for 2026, and so it's hard to take that individualistic, you know, uh, uh, approach to your own health if you can't even afford to see your own doctor.
Right.
But I mean, that does go along with kind of this ultra conservative view on government, I suppose. It just, is an odd approach for the wealthiest country in the entire world to take when, we have the best medical research. We have so many resources available for people if, we would continue to try and make sure that people have access to that instead of taking
Right.
that away. As far as, what you're looking at with these hearings, do you think that there will be some accountability for RFK Jr.? Do you think that Dr. Cassidy and some of the other Republican senators who were on the fence are taking a look at his record and seeing these waves of resignations and seeing how medical research is being dismembered from the inside? Do you think that they will join the calls for his resignation?
Well, listen, I think the key is probably with Cassidy, right? Cassidy has a lot of credibility within the Republican caucus and the Senate on these matters because he is a physician, right? And he talks about that and touts that, and he is. I don't remember the last time he practiced. I know he was a guest, or he is a gastroenterologist, but has always very much promoted vaccines, and his questioning that I saw the beginning of was really trying to pin Kennedy down when he, suggested that Trump should get a Nobel Prize or should have gotten one for Operation Warp Speed. Kennedy said, "I agree," but then said, but the vaccines killed more people than the virus, right? So he was catching him. I'll be interested to hear how the rest of that 5 minutes went, because yeah, I think Cassidy has a role to play here. Will it end up in a resignation? Like, this doesn't seem like the kind of person who resigns, right?
Right. Right.
Right. The ego of RFK Jr. doesn't seem like someone who would like admit fault. Could it result in Republicans having more hearings, right? More accountability, just making life difficult enough for Kennedy that they're kind of hamstringing his ability to do damage. Hopefully, I guess I'm hopeful about that. It's going back to something you said about the U.S. healthcare system and the expense of it all. Senator Cornyn from Texas had an interesting question. He didn't go the place he should have gone, but he said, "Boy, the U.S. has the most spends the most on healthcare of any industrialized country, but we are near the bottom of those countries on health outcomes. With infant
Mm.
mortality and with life expectancy." And Kennedy agreed, and they never talked about the single biggest driver of healthcare costs in this country. It's profit, right?
Mhm.
There are so many people extracting profit from the healthcare system. Big pharma, big insurance companies, insurance companies with 20 to 25% overhead
Mhm.
on every dollar you give them as a premium, just to keep their apparatus alive, to keep running ads on anything you watch on streaming services. And then the private equity kind of takeover of hospitals and
Yeah.
doctors' practices and massive hospital consolidation. Like, these are the drivers of healthcare costs in this country. We know what we can do about that, right? We can regulate the price of drugs, what we're willing to pay for drugs. Trump spoke about that. He signed an executive order about that, and then we don't hear anything, right? It's a press
Right.
conference, right? It's a press moment to make it look like they're doing something. I know at the committee we've worked in coalition in states to enact prescription drug affordability boards in Colorado and Minnesota and Maryland, and currently seeing those boards starting to set upper payment limits for drugs to limit the cost of drugs, right? We've advocated against the private equity takeover and hospital consolidation through various means. But boy, Cornyn and the Republicans in charge and Trump, they had not seemed to have wanted to do anything about any of this.
Right.
So it's peculiar that they have identified this as a problem. We agree completely. We've got a whole menu of items that are there to help solve the problem. They're not interested in doing that, right? They're more interested in taking healthcare away from people and passing tax cuts for billionaires.
Yeah. And I think it's also important to note that RFK Jr. has made quite a bit of money, suing over, vaccines. And that was something that he refused to say he would stop doing, even in
Right.
office. And so, he clearly has found a way to profit within the system himself. And I know that one thing that you try and do a lot of at the Committee to Protect Healthcare and at Paging America is to try and debunk this just torrent of misinformation out there in the medical sphere. And, sometimes I think I thought that was bad back in the early days of COVID in 2020, but it just seems supercharged now. And I think at this point, there are a lot of people who genuinely don't know what to believe. And how do you try and reach people?
Hmm. Yeah, I mean, I think a lot of it is going to fall on your primary care doctors or any doctors you interact with, the people you trust in your lives to help you make the right decisions for yourself and for your families. And so that's a lot of weight to put on the shoulders of particularly primary care doctors, being the spouse of a family doc, an already overworked profession and underappreciated profession within medicine. But I think that's critical. Right. I think in states we see now California, Oregon, and Washington have announced a Western States Alliance where
Mm.
they are going to band together to put out factual, trustworthy information about public health, about healthcare. Here in Michigan, I believe her name is uh, Pamela Blackwell, maybe. There's a physician who is a faculty member at the U of M, a family doc, who was on the ACIP, the committee that Kennedy disbanded and fired everybody. And she has now announced she's trying to put together a coalition of docs in the state of Michigan to help promote what is true and factual, help promote, kind of real data, real science, and how people can make healthcare decisions. I think it's unfortunate because then it sometimes becomes state by state, right? Certainly there are some with red state governors and all that will hopefully still try to adhere to, true science-based public health information. But by and large, it's sort of falling on a red state, blue state
Right.
dichotomy here. And
Right,
so I
in
think if, yeah,
Florida, the
uh,
Surgeon General just announced that he doesn't wanna mandate any vaccines at this point.
yeah, and they're working
Um,
to do that. They're
yeah,
working to undo the vaccine mandate for kids in schools. So if you have kids in schools in Florida, boy, like relocation may become a real tangible plan for a lot of these people. Because
right,
again, if you get your kid vaccinated, we 100% acknowledge vaccines are not 100% effective, never have been. And so if you have this entire soup of infectious diseases that could have been prevented swirling around in your kid's school and your kid got vaccinated, you know, the, your kid still could get one of these diseases, may hopefully not as severely, but still are at some degree of risk, and then bringing it home. And as adults, we're a little more susceptible to some of these things because some of that immunity wanes over time, or the elderly
right,
grandparents. I mean, it's just yeah, what's going on in Florida is unbelievable that they have
right.
that guy in charge and that they're trying to do this.
And, the whole idea of vaccination and reaching the point of herd immunity where, we reach a point where, we can, make sure that these diseases don't spread, widely is, that we're all in this together. And because there are some people who don't have the immune system where they can get vaccinated, and there's some people who are more susceptible to getting ill, like my son has asthma, and that was a
Mm,
huge concern for us during COVID. Frankly, it's a concern, during flu season. And so,
right.
if we all pitch in, we can help, especially, people who are seniors, people who have compromised immune systems. And, we all benefit from this. And that this was something that, 20, 30 years, we all kind of, we all kind of understood this and we did this. And now with charlatans like RFK Jr., making us doubt things and telling us that there are easy ways out, we're at this point where we have the technology and people don't want to use it. What a tragedy it would be if we go back into the times where you start to see more graves at the cemetery for babies, which
Hmm.
is something that used to happen before we had, vaccines for polio and mumps and measles, and none of these diseases have to be fatal for the vast majority of us. So, I certainly hope that we can get to the point where people believe that there is this shared set of facts out there. I don't know when we can get there. I also don't know what's going to happen with the CDC. Let's say that there is a post RFK era at some point, sooner or later. What would need to happen to rebuild what he has done there? Because we are facing so many assaults, whether it's people losing their health insurance, medical studies that have been disbanded, some of the finest experts in the country have quit. How do you rebuild a structure like that?
Yeah, I think we can't sit and wait for the CDC and the government to do it themselves, right? You can't turn it back on like a switch. We have taken it at our organization, the Committee to Protect Healthcare, along with others in coalition, as a responsibility of advocates, right, to flood the zone, to come on here, to go on as many shows as we can, to be present and communicating, this message and this factual, science-based recommendations and this objective truth about public health, about healthcare, and particularly about vaccines. That we do it every channel we can, right? I never turn down a request for something doing media somewhere, whether it's on Substack or a podcast or Sirius or local TV, national TV, whatever, because you never know who might be listening. And if you do it enough, and enough people are doing it, and you have doctors and scientists and teachers and people in the press and just anyone out there, people from the religious community, you absolutely need to flood the zone because they have really mastered the ability to do that, right? The other side is absolutely flooding all these channels. I mean, I think YouTube has to be a big part of this. So many young people get their news from YouTube, right? They don't watch the news anymore.
Right.
And so staying ahead of all those kind of channels of information, and again, the idea of just flooding the zone with the truth, I think that is part of the path to rebuilding the trust
Mm.
in science, and then, allowing for the CDC to rebuild itself. But it's going to be hard for them to do it just on their own. I think they've been damaged so much by this movement that a lot of people aren't going to turn back toward them unless they continually see this message coming up in their feeds.
Yeah. So, Dr. Davidson, if you're somebody who wants a COVID booster, and you're not over 65, what do you do at this point?
Well, I think you go to your primary care doctor. Okay. So doctors can prescribe medications off label, right? So the
Okay.
FDA, drugs get approved by the FDA for certain conditions. And then, when a drug's been around for 20 years or so, there then are studies that show that drug is highly effective at treating other things, right? And when the accumulation of those studies sort of becomes the orthodoxy, and we acknowledge, okay, this drug actually is good for this, doesn't have a massive side effect profile, we prescribe drugs that off label. It just happens, right? You take on a
Mhm.
little bit more risk, but boy, if the entire scientific community is behind that, your risk is minimal as a prescriber. And so COVID vaccines could fall into this, right? And really should, right? Doctors can prescribe it and they can give it. I think the challenge is places like your local pharmacy or the pharmacy
Mm.
chains. They're going to be reluctant to do this, and but I've read. I think Walgreens and CVS have come out and said your doctor can prescribe it. Great. You can go get it, and they're not going to ask you about any condition. Boy, I tell you, you want to look through your medical record and try to find a condition that you have or have had that might get you qualified, anyways, under the current rules set forth by the FDA. For the privileged folks who can go across the border or go somewhere else, I mean, that's been talked about by a lot of folks, going getting it somewhere else. Again,
Mm.
that's from a position of extreme privilege and people who can do that. The vast majority of people
Right.
can't do that. But I think it's going to really, again, fall on your primary care doctor and having the conversation and figuring out how they can get that for you and for your family. But whatever whatever people do, it's going to be harder, right?
Right.
they're going to make it harder. There will be fewer people vaccinated. There will be more people getting sick, and very likely more people dying from COVID this coming season.
Right. And that just seems to be a disaster in the making with a
Mm.
lot of people who might be losing their health insurance, in January, right as it's the height of COVID and flu season and RSV and all of that. A lot of unnecessary pain. Um, and I certainly hope that that's not where we're heading. So if you can take the time to get your booster now, while the weather is still a little warm, protect yourself and your loved ones. And Dr. Davidson, I really appreciate you sharing all of your insights, practical knowledge, and as well as your perspective on what's going on at the federal level as well. It's always a great conversation with you. What's the best way for people to find you online and on Substack?
Yeah, and Substack at Paging America. Please check us out and follow, subscribe. Paging America podcast episodes come out every usually late Thursday, and then at the committee to protect.org if you want to get involved.
Great. Thank you again. I appreciate everyone being here.
Thanks, Susan. Good to see you.